What's up, everyone? This is Dr. Corey Glenn, and I had someone approach me and ask about any videos I had for doing a soft tissue full arch guide design. And I knew I did, but I got to realizing it was like 9 years old. So I think this is time for an update. And so what we're going to be covering in this video is basically how you can go from taking a dual scan of a patient, that means taking a scan with their ideal dentures in their mouth, and then bringing that into Blue Sky Plan, designing a surgical guide, which you can then 3D print, and then how to do the surgery on these cases. And I'm even going to throw in a few other things that certainly were not in my old video of how I approach these things now, how you can use them with a flap, how you can add these removable teeth to the guides to make the insertion and the delivery of your pins easier. So that's what we're going to be doing, and I'm going to go ahead and go into Blue Sky Plan and start launching the case. But if you would do me a favor, please just go ahead and like and subscribe to the channel, and that'll help me keep bringing more of this free content to you. So we're going to go into Blue Sky Plan. This is the new version 5. And I'm going to click on Implant Planning and Surgical Guides. And for right now, there's a lot of different ways you can go. I'm going to just import the CT scan. All right, so with the new version, you do need to create a patient name. And once you've done that, you can go ahead and just select, is this for one arch, two arches, whatever, doesn't matter. Honestly, we'll select both arches here. And then you can go to Data Import. So go ahead and navigate to wherever you've got the CT scans saved. And, I guess before we jump into this, I should review. When you're doing a dual scan protocol, you want to make sure that you take a CT scan of the patient wearing their denture, and it should be an ideal denture with a good fit. If it's sloppy, reline it. You can use PVS or a hard reline, but a well-fitting denture with the teeth where they should be, because we're only going to be able to plan implants in the right prosthetic position if we know where ideal teeth should be. So if it's a garbage denture, just start by making a new denture. It's well worth it to avoid mishaps later on. But once we have that ideal denture, we're going to put some radiographic markers on it. We're going to take a CT scan of the patient wearing those dentures. Okay, so here's an example of that. The patient is wearing the dentures and they're radiolucent. So you don't see the dentures in the CT scan, but you do see the radiographic markers. Okay, that's what's important. And then you would take those dentures out and you would CT scan them by themselves. Put them up on some paper towels or a sponge, just on the little scanning table that most CT scanners have, and just take a CT scan of that. And now we'll show you how to bring all that together in Blue Sky Plan. All right, so you've got your dual scan, right? That's a scan of the patient wearing the dentures and a scan of the denture by itself. If you were doing upper and lower, it'd really be a triple scan because you would do each individual denture by itself. But always start with the patient scan first. All right, so I'm going to go ahead and open this patient scan. If you need to limit your field of view, feel free to do that. This is just an 8x8 field of view, so no need to do it. Now, with the new version 5, we do have the option to go ahead and bring in 3D models on the front end. I'm going to choose not to do that for right now. All I want to do is just open the patient CT. So when we click this next arrow, that's what's going to happen. So our case is now open, and hopefully you can see down here in the bottom left that you can see some radiographic markers, but you don't see any dentures currently, and that's to be expected because, again, they are radiolucent acrylic. So right away, if all you've opened is the CT scan, Blue Sky generally knows that for most cases, you're going to need more information than that. And so what do we want to bring in? If this were a tooth-borne implant case, we would bring in some intraoral scans, for example. But here, what we're bringing in is a CT scan of a denture or a scan appliance with markers, that fourth option down. So we're going to click that. And now we're going to choose to bring in the CT scan of the denture by itself. So in this case, I do have upper and lower, but we're going to focus on just the lower here. All right, we'll click OK. So this is a window you'll never have seen before if you've not done one of these, but just to orient you on what you're seeing, this upper left, this is the patient scan, all right? Hopefully you can see there's all these radiographic markers because we had upper and lower dentures in during the patient scan. The software is smart enough to know it's looking for those markers, and so it's just lowered the radiographic density down until those stand out. All right, now up here on the top right, this is the denture CT scan. And again, the software knows it's just looking for radiographic markers because that's what it's going to match up. So it's lowered the density where all the acrylic disappears and only markers are showing. All right. The bottom left window, this is, if you click OK, this is what the denture rendering is going to look like when you bring it into Blue Sky Plan. All right. And generally, you don't have to touch this. At least the vast majority of cases I've done and the CT scanners I've used, usually Blue Sky is going to give a great rendering to this denture. On occasion, you might find a scenario where this looks really porous and full of holes or whatever. If that were the case, then go ahead and use this density slider and try to adjust that to where this looks just like a normal solid denture. All right, but in this case, it looks great, so no need to do anything. And then the really important step is the bottom right. That is the stitch. So again, Blue Sky is looking for these markers in these two top windows. It's comparing them, and when it finds similarities between them, it stitches those together. And so if I zoom in closely here, do you see these red and white dots that are overlaying one another? Red and white dot, red and white dot. That's where it has matched these up. And so I didn't do anything there. Blue Sky Plan did that on its own. And all you really want to do is make sure that that in fact did happen. All right. If it did, just go ahead and click OK. Now I'll throw in here, if for whatever reason it did not match those up correctly, then you would have to manually stitch these. And so you would turn on this little point clicker thing. We would hold shift and put a dot on that one. Find the same point over here, shift and put a dot on that one. And you would want to match up about 3 or 4 common dots and then manually align it. All right. So you would come down here and hit update and align by points only. Again, I rarely have that happen if you're just doing a normal denture scan. And if you're using these particular radiographic markers, which I'll stick an image of those in here. But these are the ones that Blue Sky's kind of optimized to work with. It's almost foolproof if you use those particular markers. So we're going to click OK. And what the software has done now is, again, it analyzed it. It matched up those dots for the radiographic markers. You saw in that bottom left-hand window, that was the 3D rendering of it. And so it has simply stitched that denture and it's turned it into an STL model instead of DICOM data. All right. Now you could see this if you go up here to your surfaces panel, you'll see scan appliance model. I generally like to make it a different color from the bone just to make it stand out a little bit better. So we'll go blue right there. And really at this point, usually I'm going to turn off the denture. I'm sorry, the bone rendering. I don't really need to see that. What I do need to see is this denture outline. All right. And so if you don't see this blue outline, then in your surfaces panel, make sure you've got this hint checked on. Okay. So with that done, we're basically in advanced mode. I pretty much always work in advanced mode. You get there by going up here, clicking advanced mode. All right. That's where you'll do your implant planning and all that kind of stuff. But before I do that, I obviously want to identify the nerves. And so you've got several options for doing that. Come up here, click on add nerve, and I'm just going to do auto detect. It's always worth trying that first. Usually it's going to knock it out of the park. And if it didn't, you could then go and manually do it. All right. So notice that there's still a cursor that's active here. That's going to still start mapping additional nerve points. Do you see this nerve going all over the screen? So I'm going to Control Z that back. I say that, though, to make sure that you come up here and uncheck this blue Edit Nerve button. All right. So now we're back to normal. Now, again, this usually works great, but I always want to verify it, obviously. And so I'll usually do that in this axial slice. What I'm looking for is at the level of the mental foramen, I want to make sure that that looks like it's going out properly. And if you feel like there's maybe the slightest of an anterior loop here, until you've locked this, you've got these nodes along the nerve that you can drag around and position where you want it. Okay, so as I'm going up and down there, that looks like it tracks along perfectly. If you want to see it in the cross section too, same thing. I'll go from the mental framing and start scrolling back, and you should see it tracking along there. So these look great. I'm going to go ahead and lock those so I don't risk messing them up. All right, so now the question would be, what kind of restoration are we going for? Is this going to be for a 2 implant overdenture? Is this for a 4 implant overdenture? Is this for a fixed hybrid, right? All of those have different space requirements. And so you've kind of got to start by identifying what is it that we're going for in the end result. So just to keep this video shorter, I'm just going to do this for an implant overdenture. And so let's go up here and let's click on add an implant. And I'm going to use the BioForte implant from Blue Sky Bio. I don't know the size I need to use, but since it's going in between the foramina, I figure I can go at least 11.5. And a 4.3 diameter implant is usually a great place to start if you don't know otherwise. They're in the mandible. One additional thing I would suggest is tab over here to abutment, and let's add a custom abutment and make that 20 millimeters long. All that's going to do is just, give us an idea of where this is going to emerge within the denture. All right, so we can click OK. And now wherever I click, that implant can be added. I'm going to go for the canine areas. All right, so drop that into any window just by clicking. But once I've got it in place, I'm pretty much going to do all of my implant positioning and fine-tuning in this upper right window, which is the tangential view. All right, and so here I can see I need to bring this more lingually. Obviously the crest is right here, but there's no point in doing that and trying to graft, ground up dead people onto that. We want to put it down deep enough to get the implant fully within bone. I'm also mindful of these big cortical plates here. And, I want to try to keep these implants parallel, as much as I can. And I also want to avoid being like half in the cortex and half out. If you try to drill that, it is going to deviate your drill. Like that's going to deflect off that hard bone. So really what I'd like to do is just ride that cortex down right in that area. And that looks pretty good. All right. Now you can kind of dance around between all of these different windows. I can see here, I'm actually more in the premolar position. So I could bring that over with this, get it more in the canine site. But again, I'm always doing my fine tuning in this window. So if I was doing a hybrid, I would really be paying close attention to coming out lingual to the incisal edge. If this is for a overdenture, I'm less concerned about that, and I'm more concerned with coming out in the bulk of the acrylic. All right. So if you're anything like me and you've freehanded some of these cases, chances are you've had to build in some little lingual denture tumors or maybe even buccal because your housing is outside the confines of the denture. We want to avoid that. And again, it goes back to the reason why you want to start with an ideal denture. So this position right here looks like, once this emerges out, it's going to be in a large bulk of acrylic. It's still in a good position if we had to do a hybrid later on. So I think that's where I'm going to go for. And once we've got that in place, now we can go ahead and add another one. Now, the simplest way to do that is to just simply, and actually I'm looking here, I'd like to upright this just a little bit. So from this direction, I'm going to spin this upright, just get it a tiny bit more vertical. Again, I'm sliding down that lingual cortex. That looks good. All right, so if I want to get another implant in, easiest way is just right click and say duplicate, and then it will be another implant exactly in the same position. You can just drag that off. And so I'm going to just drag this over until it's at the other canine position. All right, just like you see there. And unless I spin this implant, those are perfectly parallel. Parallelism is really important in locator overdentures. I know they sell extended range housings and all that stuff, but I'm telling you, if you're more than about 12 degrees out of parallel, you're just making more problems for yourself. You'll be burning through attachments. They'll pinch them. It's just a huge pain in the butt if you don't get these things pretty parallel. So right now we have these implants perfectly parallel, but now I want to fine tune my positioning. So again, I'm always doing that up here. And really this looks pretty darn good. I don't have to have absolute parallelism, but I want to get it within, again, 10 to 12 degrees of parallel. So depth wise, I might bring this down just a touch, and I might choose to angle this just a bit more towards the incisal edge, just so that I am in that thicker part of the acrylic of the denture. All right. So this would be our positions, and you can see they're really parallel. I probably rotated them 2 degrees out of parallel from where they started. We've just got each canine position. This would be a home run, easy case. We don't even have a lot of bone reduction to do. There's just, a couple of millimeters of bone up above the crest there, or up above the platform of the implant that perhaps I would just adjust at the time of surgery. Maybe not even necessarily do that. All right, so now we would be ready to make the guide. If this is all the implants we're planning, then we'd be ready to make the guide. All right, so what kit are you using? I'm going to use the fully guided Blue Sky kit. You need to turn your guide tubes on. All right, so that's this window right here. And if you use the tubes that are in there as of today, it's going to default to using those metal sleeves. All right, and that's all fine and good. You can do that if you want to. Personally, I like to do it without a metal sleeve. Again, you don't have any cutting surface when you're using a keyless drill. You don't have any cutting surface in contact with that plastic. So if you want to go to the keyless drills and not use a metal sleeve, usually for my printer, I'm going to go 5.15 millimeters on the diameter, because the built-in keys are about 5. So go a little bit bigger than that. Height. All right. So let's first of all just understand what these parameters are. Notice when I change height, I'm going to go here from 3.5 to 8, just so you can see it. So I've just changed it from 8. You notice what it did? It didn't move the top of this tube. So height is talking about the overall vertical height of the sleeve that you're creating. But if you add to the height, it's adding it downward. Okay. Whereas, let's go back. I'm going to just set this at 5. And every time I do that, you see I'm getting a little warning. It's just telling you, hey, you're deviating for the settings for those metal sleeves. All right. But as long as you know you're doing it and you're okay with that, then no big deal. All right. What about offset? Well, the offset for this kit is 8.5, and it can be up to 12.5, depending on how you do your settings. So why is it set at 8? Well, again, this is set for the metal sleeve, and that sleeve has a additional height of 0.5 millimeter on the lip. So that would get you to your total 8.5 millimeter offset for the Blue Sky kit. All right. So I could just change this to 8.5 manually. There we go. All right. So we could use that. But one thing you want to be aware of is if this is going to truly be a soft tissue supported guide, you want to avoid having tubes sticking through the bottom. All right. Now, the newest Blue Sky Bio kit actually has some additional drills in it. They're longer drills with longer offsets, and they're a bit skinnier. This is usually for anteriors, for immediates, or I love them in a scenario like this because they do already start with a longer offset. So you can use a 12.5 millimeter offset with these. I'm going to plan this case to use those particular drills. All right. So in that case, the parameters are different. The guide tube measurement should be at 3.85. Height is 5. I'll just leave it at that. And then we're going to go 12.5 on the offset. And again, this is for the newer Blue Sky guided drills. They're just going to be more conducive to this. And you can see that now I don't have that show through of my tubes when I'm doing this. All right. All of this is subject to whatever kit you're using. You can use any kit, any implant system, but you just need to know the parameters for your kit. And every manufacturer can give you those. So now that I have those turned on, and I'm going to turn the transparency down just a little bit so you can see here. Do you notice that only took effect on one of these implants, right? if I wanted to use that kit on all of these implants, I need to do that to all of them. So I could either select this implant and now repeat that, but chances are you're going to use the same kit on all the implants. So as long as those implants are unlocked, I can say apply to all. It will apply that same parameter setting to everything. All right, so we've got guide tubes turned on and we've got our STL denture here. I'm going to go ahead and lock the implants because I'm happy with where everything's at. Now here's where the easy part is actually making the guide. We're clear of nerves and everything. To make this guide, all you need to do is open your guide fabrication panel and make sure you've got all this stuff correct. This is a mandible. We're going to do what's called a scan appliance guide, meaning this was our scan appliance, the denture with the radiographic markers, and we're going to turn that into the guide. So unlike on a tooth-borne case where you draw the curve and all that stuff, here it's real easy. In this drop-down menu, choose whatever the denture model is that you've imported, and then I always lock the implants in the teeth. I use the automatic brush, and all we've got to do here is click Create Scan Appliance Guide. Again, just make sure you do have your tubes turned on because that's a critical part of this. So let's create Scan Appliance Guide. Okay, so if I go back to the surfaces panel now, you see I've got two different STLs here. We've got one that's called Scan Appliance Model. That was our denture. And then what happens here is all it does is duplicate that denture, but it builds in those guide tubes. All right. So you could use it like this. Now that's one option. I've done cases this way, and as long as there's a good tight fit to this denture, then that's probably fine. But I would suggest that you go ahead and add some lateral stabilization pins. I'm going to just delete this guide for the moment. Let's go back and show how I would add some pins for this particular case. So the reason we would want to use pins is to engage that guide into the bone where it stays put without us depending on holding it in place throughout the procedure. All right. So to do that, I'm going to click up here on Add Implant, but this is not an implant. We need to go over to Pin. All right. And I'll click OK. I'm going to drop one right in the midline. And again, I'm always going to do my fine tuning in this window. Now, the important part, if you're doing a denture-based guide like this, is that, for example, if I go with this position right here, well, I'm actually not pinning to anything, right? It's not even passing through this denture. So you need to make sure, you can read the flanges and the depth of them everywhere. You need to make sure that this is actually passing through both the denture and the bone, right? So there, that would work. And once that's done, just like with the implants, I'm going to right click, duplicate. Let's pull one over here, and we'll fine tune those in a minute, and then duplicate and pull one over here. All right. So now let's start fine tuning those. All right, that looks like it's passing through both the denture and into the bone. Make sure that your pen is not going through the lingual cortex. That's potentially a bad day if you do that. Make sure it's not hitting any implants. Should be clear of those by a couple of millimeters. And now I'm going to click on this one and we'll check it out. And it also is passing through both the denture and the bone. But you'll have to have more of an abrupt angle on this to get it to pass through that denture if there's a shallow vestibule on the patient. All right. So only difference in doing it this way is, once again, I just need to turn on those guide tubes for the pins now. All right. The pin drill is a side cutting drill, and so generally I would recommend, I've done it without the pins. It worked out fine. But, just for the sake of this video, since it is a side cutting drill and possibly could create some shavings, I would recommend just go with the default settings and use the metal sleeves that Blue Sky recommends here. All right, so let's build this guide again. All right, back to guide panel. We're going to do the exact same thing. Make sure all your tubes are visible. Create scan appliance guide. And there we have it. So again, we've got two STLs. And if I hide all these implants, you can see now, this is our surgical guide. All right. Now, personally, it would annoy me to have those teeth in the way right there. So I would probably just cut these off. Um, you can go in your surfaces panel and use this cut tool. And so what I'm doing here is I'm just orienting this guide. I'm going to just make a flat cut right through that. And so in surfaces, if you scroll down here, we're working on this green guide, and here is the cut button. Now this tool cuts indefinitely anything behind it, and so you wouldn't want to have part of the guide that you're wanting to keep in the way. And I am cutting through just a tiny bit of that tube, but that won't really have any effect on things. All right, so that would be my final guide, and that looks great. We could work with this all day. So what's nice about this is that it's going to pin in place really nicely, and I'll show you in the actual slides after this. This enables you to do it flapless, which is one way, but I don't love flapless surgery personally. So you can also do a flap with it, which I think is really nice. It's just a different way of approaching it using the same guide regardless. Okay. So here's our final guide. Now, I mentioned to you, being able to make a little section on this guide that would be removable, that would enable you to have the full denture. And what that lets them do is when you're orienting this guide, you don't want to necessarily rely on just your fingers positioning it ideally. Hopefully you can do that, but it can be difficult to keep it in place as you're drilling those buccal pin holes. For me, it's really preferable if I can have the patient bite that denture into place. That gives me a lot of slack in their lips. And now you can drill those buccal pinholes with them biting, and that keeps everything really dead stable. And so let me show you how I would do that. All right. So hypothetically, let's turn on our original model. What would we have left if we took our original blue denture and subtracted our green guide? All right, think about that. If you did that, all that would be left is basically this blue section of teeth, right? And that would now become another file. So let me show you how I can do that in Blue Sky Plan. So that's known as a Boolean difference. All right, so many people don't realize there's Boolean functionalities in Blue Sky Plan. Let's go into the Crown and Bridge module. And then we're going to choose the tooth editing panel. All right. So when you do that, you're going to see right here is Boolean operations. It's collapsed. It's kind of inconspicuous there in the program, but this is what we want. All right. We're going to do a Boolean difference between our blue original denture model and our green surgical guide here. And it gives you the option of adding an offset. So you would want to add an offset, I would say, of about 0.2 millimeters. What an offset is think of it as a spacer. If you just do a dead zero subtraction, you're not going to get these pieces to fit together because it's just too tight. Right. So even when Blue Sky makes a surgical guide on teeth, it's building in about a 0.2 spacer. And so we're going to do it with an offset of about 0.2 millimeters. And now let's apply that. All right. And you see there's now a new tan surface there. So that's all I needed to do here. I'm going to go back into the advanced mode where we were doing the implant planning. And let's look at that now. All right. So that Boolean difference subtracted away everything where that guide was touching the original denture. Now, I don't need this pin tube stuff down here. We could just come select this model, and in your surfaces panel, there's an isolate button, and just click that one piece you want to keep. And then beyond that, we don't need these things sticking all the way down into those guide tubes. I could also just say cut. I do want them sticking there just a little bit just to help orient these things in place, but right there would be about enough. All right. So now if we were to save both of these, this is what we would have. All right. So imagine you printed your surgical guide in the green, and then you printed also this little tan piece. And now you've got everything you need to go and do a surgery like I'm going to describe. So I'm going to export these, and then you would print those. Let's go to export data. Those are the only two models that I want to export. And we could do them one by one, or we could say, hey, export each of these files into a folder where they're separate files. And I'd just create a folder in there. Let's call this denture guide. All right, so those files are exported and we're basically done in Blue Sky. If you wanted to, you could go ahead and run a drill report that's just going to generate some images that you could print out. I like to do this and just have it up on the 12 o'clock unit behind the patient. All right, add notes if you want to. But all it's doing is creating this little PDF that's good for putting in the patient's record, and it has a snapshot, buckle, and cross-section of each implant site, each pin site. That way you don't have to, if you have a question about something, you don't have to deglove in the middle of the procedure. All right. So that aside, let's go back and look at a clinical case that I helped work on where we took this approach. So here's the original patient. On this case, we were working. I was working with Dr. Aaron Carmine, who's a friend of mine here in Tennessee, and so he took the dual scan, right, radiographic markers on the denture, patient wearing them, and then by themselves. All right. We could have done this in the case we just did. We could have done bone segmentation, but this is not a bone supported guide, so there's no need to really do that. All right. In this case, we were going to do this for a hybrid, so we actually planned 6 implants, but the approach is the same. It's just a matter of how much prosthetic space are we planning for, and then how many implants are you sticking in the guide. But how we're using it won't change here. So here you see our 6 implants. You see that we used 4 pins, and this is how everything lines up. We've got nice positions where we're emerging within those teeth, and this was the resulting surgical guide. All right. Now, again, remember, I told you it can be somewhat difficult to orient that denture and hold it stable while you're drilling those buccal pins. And so we did exactly what I just described, which is we made those little removable teeth sections. And that's super helpful because now the patient can just put these in, bite them into place, and that actually gives you a lot more slack in their lips to pull them up, drill those pin tubes, insert your pins, and then start your surgery. All right, so here we're doing the lower arch, and you can see the patient's just wearing their normal upper denture because, again, this was a duplicate of her, it's a digital duplicate of her lower denture, but notice here the little split between these. So when she bites down on this, this is her surgical guide, but with that tooth section added, she's got a nice stable bite, and look how much slack that gives us to pull down the lip and now drill these. Plus, as we're drilling it, it's not going to want to deflect and push lingually or push off to the side. And that's important because if your guide shifts any during the placement of those pins, well, now you've pinned it into the wrong spot. And so I really prefer this method. All right, so here we're using those 2-2 pin osteotomies. Again, I told you I've done it without the metal sleeves. Do as I do, or say not as I do. But we got away with it here. All right, these are the teeth. So all the pins have been placed, and now this can be removed. Now, if you were going to do a flapless surgery, well, now you would just start your flapless surgery. All right, but I don't like flapless surgery. I don't think patients generally have that keratinized tissue to spare for us to go blasting through and cutting a 5 millimeter hole in it. And beyond that, I want to see that bone. Almost always I find you need to modify the bone on the crest, smooth out some little areas. So I would much rather have a flap. So how would we approach it if we wanted to do a flap? All right, let's show you. All right, I removed the teeth. So the way I approach this is we'll take a little indelible ink stick and we're going to just poke it through each surgical guide hole and just create a marking on the tissue on each of our surgical sites. And then pull your pins out and just remove the guide entirely, okay? And once you do, you'll see that you've got your implant positions marked. So we're going to make a lingualized incision, just lingual to each of those implant sites, all right? And we're just going to reflect that buccally, leaving the lingual tissue intact. because if you go just lingual to your implant sites, well, the burrs are not going to chew up your tissue there. There's no need to reflect that. All right. So this is Dr. Carmine reflecting all of that. All right. Identified the mental foramen. So this is a soft tissue supported guide, right? It's just a replica of her denture. And so when we insert this back in, of course, the lingual tissue is still intact. And in the very back, around the retromolar pads, that's intact. But you would expect this thing to dip on the buccal and not be as stable since we've removed all that crestal and buccal tissue. But that's the point of drilling your pinholes first, right? Because once we can realign this, it's sitting on lingual tissue, and then we push in our buccal pins. Once all those pins go into place, this thing is rock solid. It is exactly in place where it was previously, and it's not moving. And now you can have everything pinned in place as you're doing your surgery. All right. So that's what we did. We're placing these 6 implants. We're using the Blue Sky kit, and we just went through the drilling protocol and proceeded up in our drills, took some check films, all that fun stuff, and then placed we were using Biomax implants and placed 6 implants in this patient's mandible. And once they were guided into place, now we can actually remove that guide, and any, areas of smoothing on the bone that we need to do, we can do that. It also enables you to do a 2-stage surgery, which if you do flapless, you're kind of committed to putting on a healing abutment for the most part, unless you placed them really deep and suture those holes. But here, a lot of times I prefer, if I'm not going to immediate load, I would rather bury them. And so they tend to heal better in my experience that way. So once we've smoothed up the ridge, we can put on some cover screws, and we've got all our tissue still present, all of our keratinized tissue still present, and we can just suture this thing closed. All right. And so the implants were guided in place. We got great torque. Could have done immediate load. We just chose not to do it on this case. But that's really what you're after. You can see 6 implants, dead on the money, exactly where we planned them. And again, this is Dr. Aaron Carmine. This was actually his first full arch surgery he ever did. And it went really smoothly. We actually did a post-op cone beam and brought it in and superimposed it. I mean, the implant positions were dead on. What you're seeing here in the green, that is the post-op implant positions, but imported back into the pre-op planning case. All right, so these are my planned implants in my initial case. And man, they're right on top of one another, which is exactly what you would hope to see. All right. So that's the way I would approach these cases. Stackable guides, they're all great. Nothing bad to say other than that they're complex. And if you're farming it out, they're very expensive to make. This is a guide that anyone, if you'll just sit here and find a case to practice on, just work through it a time or two. This is something virtually anyone could do without a ton of training. It works really well. It's a simple and affordable approach that will get your implants right where they belong every time. So anyway, I hope that was helpful to you. If you're interested in taking some courses, check out my website at coryglenn.org. We've got an upcoming digital denture course, an upcoming advanced full arch guided surgery course, and then there'll be more dates posted depending on when you watch this. So hope you found that helpful. We'll talk to you later.